Hello, dear students. Continuing with the subject of congenital heart diseases, the first heart disease in your syllabus is atrial septal defect. Now, what is atrial septal defect? Atrial septal defect means there is hole in the interatrial septum. So, this diagram I have presented in that big video which has been uploaded in the app Dr. Ashok Kumar Rana, which you will get it from Google Play Store and subscribe to it, and you can purchase the course, that is BDS third year medicine course. In that course, this detailed video will be there. Now, some important points I will be introducing in this short video. That is a hole in the interatrial septum. Now, as you know, left atrium has high pressure, right atrium has low pressure. So, there is flow of blood from the left atrium to the right atrium through the hole. This is called shunt. Now, this is one of the commonest congenital heart disease which is diagnosed in children, and it is more common in females as compared to male in the ratio of 2:1. Now, what are the various types? It is of three types: ostium secundum, ostium primum, and sinus venosus ASD. Ostium secundum defect is the commonest. That means up to 70% patients of ASD will have ostium secundum defect. 20% of patients will have primum defect, and 10% will be having sinus venosus. This is most dangerous, this is less, and this is commonest one. Now, this defect leads to, that means the pathophysiology, this defect leads to what it leads to. The oxygenated blood from the left atrium goes into the right atrium through the hole, and from here it goes to the right ventricle, and right ventricle supplies this blood through the pulmonary artery to the lungs, and from lungs it is given back to the heart through the pulmonary veins. Now, what it leads to? It leads to overloading of the right atrium, because already blood is coming from the superior vena cava, inferior vena cava into the right atrium, that is deoxygenated blood of whole of the body, plus oxygenated blood from the left atrium. That means the volume on the right atrium gets overloaded, and similarly when this volume is passed into the right ventricle, this right ventricle also gets up overloaded, leading to volume overload on the right side. Similarly, this will be transmitted through the pulmonary artery to the lungs, leading to the picture of pulmonary hypertension, which gradually becomes permanent feature and leads to ultimately heart failure. So, this is the pathophysiology of ASD. So, with overloading of the right atrium, it gets dilated, right ventricle gets dilated, and lungs, and a stage comes when this pressure becomes more than the left side. When the pressure on the right side becomes more than the left side, it will lead to reversal of shunt, that is known as Eisenmenger syndrome. When this reversal of shunt occurs, it leads to the picture of cyanotic heart disease. That means there will be cyanosis, central cyanosis. What is central cyanosis? That means bluish discoloration of the skin and mucous membranes. In which areas it will be seen? Tip of the tongue, buccal mucosa, lower palpebral conjunctiva, and peripheral also on the nails and toes. So, there will be cyanosis, and that picture is reversal of shunt or Eisenmenger syndrome. Now, the clinical features that may be, initially it will be asymptomatic, as the patient doesn't have any type of complaints. If the hole is small, if the hole is big, then the patient is likely to have the symptoms like breathlessness, palpitation, cardiac failure signs like shortness of breath, swelling of the feet, pain in the right hypochondrium because of hepatomegaly, etc. There may be arrhythmias, that may be atrial fibrillation, PSVT, and atrial flutter. So these are important clinical features which may be present in a patient of ASD with big hole. In small hole patients, they may be diagnosed coincidentally as they are examined for some other purpose, for general examination, during employment, during admission to the colleges, etc. So I will again request you to go to the Google Play Store, download my app Dr. Ashok Kumar Rana, subscribe to it, and you will find there the detailed video about this ASD. So physical signs like features of heart failure, arrhythmias, and other things may be cyanosis may be present in reversal of shunt. So diagnosis is done on the basis of echo ECG, X-ray chest, etc. Treatment according to the whole size, the treatment is planned. So this is a small introductory video about ASD. For details, you will have to go to the app Dr. Ashok Kumar Rana, and from there you get the material about this topic ASD. Now further in the next videos I will be discussing about VSD, PDA, fellows tetralogy, etc. Thank you for watching the video.